Hello. How nice of you
Hi,
to
Miss
join us.
Trudy.
Hi.
Hi, how are
How are
you?
you? Oh, you know what? I was just about to introduce that two of my favorite people are with me today, and we're going to all three of us share some information that I hope will be beneficial to our audience today. And it's just wonderful to see both of you together again. Two of my favorites, Dr. Galluzzi and Dr. Joseph. How are you
Hi,
both?
good. Nice to
How are
see
you both
you.
doing?
Very
Can you
well,
hear me
thank
all
you.
right?
Yeah.
Yes.
Okay. I'm so glad you could get together because I have been sort of subjected to, I guess you would call it an information that isn't very comfortable for a lot of people. And particularly when I found out that I had it, thanks to Dr. Galluzzi, it made me very uncomfortable. And I found out that a lot of people aren't quite sure exactly what hospice means. HOSPICE, right? And I thought it would be nice if we had kind of a little chat about it so that people will feel a little more comfortable with it and to treat hospital the way you're supposed to treat yourself when you're under it. And Dr. Galluzzi, you're the one who kind of put me on this direction to know what hospice is because my husband was on it before he died, and I wasn't quite sure what it meant. And then you came out with the paper to stick me on it, and I didn't know what was happening. I thought that was my, you know, attention that hey, you don't have much long hair. And then I
Mm.
saw this paper go up on the wall, and I said, "Uh oh, this is it. This is the final chapter. This is the long walk." So suppose we start off with my understanding, and I know you're going to have to correct me. When I saw that paper, I thought I was doomed, that I only had a few more days, and that I had to undergo some terrible things in my last few moments. But it wasn't that at all. Hospice is a very comforting position to be in if you're in with the right people. And that's partly of what hospice is all about, you and the medical profession. And I want to thank you, Dr. Gillespie and Dr. Joseph, because both of you are quite involved with this condition. And so let's start off with what is it? Is it the final walk? Is it the last mile? What is it?
Well, I'm so glad we're having this conversation, Trudy, because when most people think of hospice, they think it's a place. And hospice is not a place. Hospice is a philosophy of care in which we embrace the totality of the individual who is facing either serious illness or possibly coming to a final chapter in their lives, as you've said. And unfortunately, most of us think we're going to live forever. But those of us in the medical profession, certainly someone who's been doing it as long as I have, I'm going on 40 years now. We've come to realize that we can't cure everything, and that death is the natural endpoint in the life cycle. And the goal for hospice is to make that endpoint, that final chapter, if you will, as you said, as comfortable and as reassuring and as surrounded with care as we possibly can.
Yeah, that's right. When I think of hospice, it's really more about supporting life as opposed to, a lot of people think of it as it's that final chapter and there's nothing left that we can do. But really, it's about making sure that you're comfortable and making sure that you have an improved quality of life no matter how long we have left. So it really supports life.
Yes, and there is no endpoint. A lot of people say, oh, once I'm on hospice, that means it's over. And that's the other thing with palliative medicine. In palliative care, we really don't strive to put any time limits on anything, nor do we try to limit any interventions, therapeutics, or medical care. On the other hand, we recognize that some of the things that we might be trying to do don't make sense or are frankly futile, not effective. And so what we try to do is to focus on things that we know are going to, as Nicole said, support life, and importantly, quality of life. And what is quality of life? Well, each of us has our own definition of quality of life. You know, if I can't have a glass of wine at the end of the day, or if you offer me some chocolate and I turn it down, then I'm going to be seriously concerned that my quality of life has been diminished.
Right.
And, you know, everyone's definition is different. And that's what we strive in palliative care to identify what matters most, and then to do everything we can to support the individual in getting that
Mhm.
thing that matters most.
Is hospital lady something that you just automatically get, or does it is it prescribed by someone in the profession, and of course should be someone who knows what they're doing and saying to you, because it can frighten you a little.
Yeah, I agree. You know, it's very, for some families, it's very difficult to think about hospice, to think about that final chapter. It is a Medicare benefit. So for patients who are over the age of 65, patients who qualify for Medicare, it is a benefit for those patients. So if you have a terminal illness, or if you have a prognosis of less than 6 months, that's not to say that that person is going to die within 6 months. Um, you know, whatever that prognosis of that patient is, it is a Medicare benefit that patients would qualify for.
Right. And so you do have to have a physician certification that states that the individual is, probably approaching the end of his or her life. And again, it's not just age related.
No.
Unfortunately, we have children on hospice. We have some excellent pediatric palliative care programs here in Philadelphia,
Mhm.
and they're vital because, families who are facing the death of a child really do need the kind of all-inclusive support that hospice can give them. So yes,
It's
we you do.
also
What I was going
it's
to say is
also
you
a
can
condition, I
really do
think,
it.
that can apply to a child, an adult. It doesn't matter if you're male or female, or if you're black or white. It is something that you can go through, and I want to say, thank God we can go through it, because it has relieved a great deal of pain.
Absolutely. You know, hospice can be available for children, for young adults. There's even what we call perinatal hospice for individuals who may have a terminal diagnosis for their unborn child, where they can support them throughout that process if they choose to go through that pregnancy, and support them after the baby is born. So it is for all individuals, regardless of age, regardless of race. It's available for them.
And when we're talking about it being a benefit, we're talking about really money that's available to purchase the types of services that people who are facing serious illness might need. For example, someone might need a wheelchair, or they might want to have an electric hospital bed in their home because they're having difficulty with mobility. Now we know that doesn't apply to you, Trudy, because you're still spry as they are. But, for some people, medications can be extremely expensive, or other types of treatments that are needed, which would otherwise be very expensive and maybe cost prohibitive for some individuals. And the hospice benefit assures that all of those things will be covered.
Is this
The other
something that could be covered under your insurance, your health insurance, or is this something that must be dictated to for you from by the hospital, or how do you come about it? Someone has to say, "We're going to put you on under hospice."
So, in order to qualify for hospice services, you have to be certified by two physicians. So, that physician could be your primary care physician, as in your case, Dr. Galluzzi, and also maybe a medical director for hospice, or for some people, it might be their primary care physician and their oncologist, but you do need certification by two physicians. Um, it is covered through a lot of insurance plans. It's a benefit under the plan, but it's also a Medicare benefit. There is the Medicare hospice benefit. that patients can also qualify for. So really, it's available for all individuals
Yeah, and I
who
think
qualify.
Yeah, and I think that's important because people should not be worried about whether it's going to be covered or not.
Hmm.
It is a federally sponsored Medicare program that everyone can qualify for. The thing that we didn't say that I think is really important, we're talking a lot about the medicine, but I think some of the most important things about hospice are the other services that you will receive. You can receive in-home nursing services, visiting nurses,
Right.
RNs, CNAs, home health aides. And a big part of it is the social worker who is able to plug in whatever is needed. For example, Meals on Wheels may be needed, or Mom's Meals, as we have here in Philadelphia. Different services like that most individuals don't know how to access, but having your own dedicated social worker is so vital in that process. And the other piece that I really feel is so important is that there is pastoral care, which is really what we like to think of as spiritual support, not just for the person who is on hospice, but also for the people around that individual. And the hospice benefit, interestingly, extends beyond the period after which the person has died or has passed. And the family members can still access that psychological or spiritual support from the hospice team. So it really is a team approach to the care of individuals. And that's really the beauty of it.
Yeah. Yeah, and one of the nice things about hospice is taking care of somebody who's sick. It's a 24/7 job. And oftentimes caregivers can get burned out. And also, you want to focus on caring for that person and just being there, holding their hand. So it gives the families a little bit of respite so that they can actually have those quality moments with their family, with their loved ones. Putting in a home health aide, for example, to help with basic care needs. Having a volunteer come in and read to that patient. All those services are actually part of the hospice benefit.
Yeah, you just reminded me, Nicole, and I've told you about this. My father had hospice care at home when he was dying of colon cancer. And when I talk about quality of life, one of the things that really gave him the most joy was looking forward to, in particular, one of his caregivers who would come maybe 2 or 3 times a week strictly to give him a massage. And that he really looked forward to that so much, and it was really important to him. So, and that was something that, none of us could have even anticipated. I didn't even know that he liked to be massaged, but there it was. And it was really something that gave him joy and comfort, in his final days. And one of the things that you may be thinking, Trudy, I'm anticipating it, is, you're thinking, I'm not in my final days. Why is she talking about this? And the thing is, we all at some point are going to fail. And, when that might happen is very hard to predict. But if someone has a terminal illness, like my dad, who had colon cancer, at the point at which he no longer was getting chemotherapy, we said, well, let's get hospice involved. And he was still up and about. We were still going out to restaurants. And the beauty of getting involved early enough with hospice is that he was able to develop relationships with his caregivers, so that even though he did continue to live for almost 6 months, he really did have this ongoing layer of support and relationships with people that when the end really did get close and he did become bedbound, and as Nicole said, requiring 24-hour a day care, there were
Hmm.
people there to do that.
Mhm.
Well, I tell you one thing. I'm grateful that you put that sheet up on my record because I really have been spared a lot of pain as I have a cancer in me that's growing in me. And well, it would have taken a lot to do something about it. But the hospice has made me very comfortable and made me very aware of how I can help these two wonderful people. And we got the best here. In fact, No, Nicole, you've been working with several hospitals that give this care, right?
Yes, I've worked, well, the both of us, we both worked with several hospices in the Philadelphia area. We've done inpatient hospice care as well as outpatient hospice care. I've been in patients' homes, seeing them, um, nursing homes. So I've been in several, in all areas of
Which brings
hospice.
up
We
the
all have
we
been.
both have, right, but which brings up the point that is, again, hospice is not a place.
That's right.
Hospice is something that will
The
come to
condition.
you where you are.
That's right.
Yeah,
Hmm.
yeah.
Yeah, wherever
And
the
of
patient
course,
calls from, that's where we go.
you're Catherine. You're being the head of the old folks hospital, the PCOM, the one that most people don't know is really for elderly people. And that's how we met, not at my elderly age, but you have been taking care of me for an elderly time, I might say. And I want to thank you for the things that you've been able to guide me. And Nicole, it's been wonderful to welcome you here at the PCOM Hospital on City Line Avenue. This is a hospital that many may not know is dedicated to the elderly. Am I right, Catherine?
That's right. We have a specialty department here, and it's the Department of Geriatric and Palliative Medicine here at PCOM. And our focus, as you rightly said, Ms. Trudy, is on older individuals. And what do we mean by that? Well, now that I am an older individual, I like to say older and older and older, but really we like to meet people in their 50s because our goal, as it is with you, when we met because I was actually taking uh, care of your mother when she was in the nursing
Yep. And
home.
then my mother-in-law, and now me
Yes,
again. And you're the
yes,
boss, so I know I've got the best two people sitting in front of me for this subject. Anyway, I want to thank both of you for being with us, for taking the load off my mind, and helping others to understand that there are conditions, even if you're getting older, that can be relieved by the qualified people. Thank you so much for being with me on One on One.
thank you,
Thank
Trudy.
you.
Mwah. Another bitch shorty.
Oh.